Hello, everyone. Welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. And over the past couple of weeks, we've been going over cardiovascular health and how it pertains in the Nigerian environment. What are the peculiarities? What the average Nigerian on the street needs to know about cardiovascular health. Our goal was primarily on brain disorders, on how to help address and how to improve brain health. But as I've mentioned in a couple of shows prior to this, we began to see people, adults and children, who were having cardiovascular issues. And this, in my opinion, this was quite shocking because we've been told that once you have a normal weight, once you exercise well, once you eat right, and once you take your medication, you should be fine. And we had people who were doing all these things correctly, and yet they were still on 4, 5, sometimes even 6 different medications for cardiovascular disease alone. And so it got us thinking and saying, okay, what needs to be done? Why is it that the Nigerian is having so much trouble with cardiovascular health? And I began to ask my cardiologist friends, researchers, and really the truth is I just didn't find any satisfactory answers. And so that forced me to really do a deep dive into the literature and into research and see what exactly is going on. What is it about the black person? What is it about the black person living in sub-Saharan Africa that makes them more susceptible to heart disease? And quite frankly, the answers have been quite revealing. And so that's what we are sharing with you, and that's why we're partnering with NTA to bring this information, this vital information to Nigerians everywhere, because we have almost 200 million people. We are seriously lacking in terms of knowledge as to how to effectively handle and deal with heart disease in Nigeria. So please stick with us. I hope some of you have been sending in your questions, and I have a few of them here. I will kind of summarize and answer them as best I can. All right, this is from Jamila Sabo, and her message is she's calling in or sending in a message from Kwara. She said in your last episode you talked about fried foods. I love fried dodo. Well, so do I. And I fry my stew and my soup. Even my okra is fried. Is that also harmful? Well, like we said before, fried foods, the vegetable oil, once it's heated, it doesn't matter what kind of oil it is. As long as vegetable oil, even palm oil too, can be harmful to your health. And then once it's fried, it takes on a different nature and different characteristic. That is, produces chemicals that can actually cause inflammation to the lining of your blood vessels. Remember, we're talking about the lining of your blood vessels, and by extension, it's also the lining of your heart. According to researchers, the primary cause of cardiovascular disease is a lesion to the lining of the blood vessel. And so we talked about some of the things that can cause significant damage or damage to the lining of the blood vessels. Fried foods are one of them. So yes, the answer is yes, fried foods can cause more damage to your blood vessels, and you want to begin to limit the amount of fried foods that you take on a regular basis, especially when you pass the age of 35, 40. Definitely by 40, you need to start limiting it. It's preferable to boil your food and cook them as opposed to frying them. My name is Kojo, and I am in my 60s. I'm not Nigerian, and I have lived a better part of my life in Benue. My daily diet is pounded yam and pocho. What does pocho mean? Does anybody know? Anyway, I guess it's a Benue thing. Pocho, the person also likes peppered stew and fresh fish. I have been hypertensive for over 20 years. Your program says with good food I can be whole again. Is this possible? Is it possible that good diet can make me all right? Don't go too far on me. With the right nutrients. Now, with the right nutrients, you can go a long way towards improving your cardiovascular health. There's no guarantee that you have complete reversal. In fact, it's on a rare occasion that simply by going on a good diet, you will get a complete reversal of cardiovascular disease. So I want you to pay attention to that. You have to take your medication. You cannot substitute good diet for your medication. Don't do that. So just it's a combination of everything. Good diet, the right nutrients, supplements, and of course your medication that makes you whole again. Hello, doctor. Great program, Your Health in Your Hands. My name is Mrs. Udo from PH, Port Harcourt. My 12-year-old son was diagnosed with high blood pressure. That's serious. He hates fruits and vegetables, but drinks a lot of water and beans. His health situation and lifestyle frustrates me. He loves to exercise. What can I do? Well, if a 12-year-old son, if your 12-year-old son has hypertension, I would say go to your doctor, because there's some underlying factor that is causing that. Kids don't usually have hypertension. So please go back, and Mrs. Udo, please have your son have a complete evaluation with his physician, please. Last question. Doctor, well done. My name is Auntie Yabo from Kuje, Abuja. I have high blood pressure for 5 years. I have been managing it I also have diabetes going on last years. Now my 2 knees are paining me. Oh boy. I dey sell mama puts. Okay, quite a lot going on here. Okay, so she's having quite a few things. I would say stick with our programs. We will answer many of your questions, but also make sure that your diabetes is under control, your blood sugar levels are under control, and also your hypertension is under control. Extremely important. These are great questions. Thank you so much for sending them. Please keep sending them. If we can't answer you direct on TV, we shall also answer you on the social media platforms. So stick with us. We'll be back for more information on your health in your hands.